know.
You have a 50 degrees in San Francisco today.
Oh,
We love the Delta breeze.
yeah. No, it's beautiful outside. It's very, very nice. Anyway, thank you, Madam Chair. This bill, AB 2551, what it does, it'll establish a Health Workforce Development Council to be jointly run by the Office of Statewide Health Planning and Development and the California Workforce Investment Board. Currently, there is no state-sponsored plan related to bolstering the state's health professions workforce. Although current law somewhat addresses the need for workforce development through the creation of a strategic workforce plan for all work fields, the complexities in health sector as well as the significant growth and demand for health services highlights a need for a separate, comprehensive plan devoted specifically to the health industry. Demographic shifts, an aging population, and an increase in individuals' access to care are causing gaps between health workforce supply and demand, which has only increased the shortage of primary care providers and other health care professionals. Unfortunately, California has not been able to respond to these changes, and thus we are very well and may be ill-equipped to respond to the new pressures on the healthcare system. With the passage of the federal healthcare reform, the need for a coordinated health workforce development plan is essential to the overall success of healthcare reform in the state. Provisions in the federal package call for state to establish coordinating councils, as well as establish available funding grants for those sorts of state activities. The governor's administration is moving forward with the establishment of a health workforce council, which will establish under a subcommittee in the governor's task force for healthcare reform implementation. I have support of members from the Latino Coalition of Healthy California, the Service Employees International Union, and the Association of California Health Districts, and I respectfully ask for your aye vote, Madam Chair and members.
Thank you. We limit testimony to 2 witnesses, 2 minutes each.
Madam Chair, Tom Riley with the California Academy of Family Physicians. As you know, this is a terribly important thing for us to be addressing as we're going into healthcare reform. Family physicians in the state are in undersupply, not just geographically, but also in terms of representation by ethnic communities, cultural communities. The areas of the state that need primary care providers the most often are the ones that have the least access to them. We urge you to support this. It is similar to a measure that Dr. Hernandez, we sponsored with Dr. Hernandez last year. We think that the time has come for this to be front and center in the healthcare debate, the workforce issue. Urge you to support. We also are working with Dr. Hernandez to ensure that there is adequate representation of the physician community, not just the educational community on this board. Urge your strong support.
Madam Chair, Senator, my name is Dean Graffila with the California Medical Association. We are in support of this measure. We believe that this legislation will help set up a system in which we can adequately address the health care needs of all Californians.
Amber Wiley with the Association of California Healthcare Districts. For the reasons previously stated, we're very much in support of this important measure.
Chad Silva, Latino Coalition for Healthy California, co-sponsored last year's measure of which Tom spoke. We urge your aye vote here.
Thank you. Any opposition? Comments from committee? We need one more member before we can establish a quorum, and as soon as we do that, we will vote on your bill. Senator Leno.
Thank you, Madam Chair. The bill says this is a 2/3 majority vote bill?
Yes.
There is an urgency.
Yes.
And that's why we're hearing it now.
Yes.
And how is it that it is an urgency that we are hearing it now?
This bill was originally in another form, and what we did is we changed the content of it, and it's brought forth to you today.
Because this is an issue you've been working on for a while.
Yes, it's been an issue that I've been actually since I got elected, and this will be the 3rd or 4th iteration I brought forward. Last year, the governor vetoed it, saying that it can be done through the administration. That was obviously prior to the Health Care Reform Act that occurred with regard to some federal dollars that are going to be available for workforce. Governor's office is doing some of this through the administration. My concern, the reason why I wanted to put the bill forward this way, and again to make that initial attempt before they leave, is there's no guarantee that that's going to be moved on to the next administration. So by putting it in statute, It allows us to do a master plan of how we're going to be addressing the workforce shortage and to be able to take advantage of some of the federal dollars that are out there to be able to capture those, to be able to do so. Senator.
Would we imagine this bill to have approximately the same price tag as the bill that he vetoed?
It could, but I think we're trying to scale it down as much as we can. Last year, I believe it was at the $150,000 mark. In last year's bill, we even changed it to the prior bill to make it such that any funds, any money that would come in, it will be dealt with through a private sector as opposed to having the state of California pay for it.
I'd move the bill.
Thank you. And when we establish a quorum, I will remember that. Thank you.
Thank you, Madam Chair.
Thank you. Members, we have one other bill, which is for a vote only, although it may have some amendments. So we will just sit here for a few minutes as things are developing. Thank you very much. All right. Let's go to file item 2. What so far is a vote only, although that may change. I'd like to establish a quorum. This is AB 52 by Assemblyman Portantino. So let's establish the quorum first, please.
Senator Alquist.
Here.
Strickland. Onnested. Cedillo. Leno. Here. Negretti McLeod. Here. Pavley. Here. Romero. Here.
So we acknowledge that all 5 of us are here. Okay. That is a good start. Assemblyman, if you would like to come forward. You all will need to tell me if there's a change. I mean, currently this bill is for vote only. I'm understanding there may be an amendment. I don't know what has transpired between Senator Romero and Assemblyman Portantino. So, yes, Senator Romero.
Thank you, Madam Chair, for your indulgence. I understand that no amendments can be taken in Education Committee, but this bill, if it moves forward, would go to Appropriations Committee. So I've asked the author, and I've met with the author just briefly right before, and we've shared these amendments with the committee. I'm asking for a couple of amendments that could be committed to but taken in the next committee. The first of them is I am swayed by the opposition in terms of looking at the fee on the birth certificate versus the death certificate. And I am concerned about the arguments that they make with respect to moving the fee from the birth to the death certificate. So I'm asking for the author to take that amendment. And that would mean various locations throughout the bill, but the concept of moving it, imposing the fee on death rather than birth certificate. The second amendment, because there would be a bidding out, I have asked for language that has been taken in other committees when we've dealt with this type of an issue that would say something that prospective agents would have to be California-based companies subject to collective bargaining. I've spoken with the author. I know that there's a concern, a hesitation with respect to that's not the case right now, but although it may be the case right now, in the future there can be contracting out. And so, and given the history of the UC, one of the reasons why I didn't give my graduation speech at UC Berkeley had to do with some tense labor management relations. So I am asking for that. I had put another amendment forth with respect to looking at penalties. I understand that might be a little bit more extreme, so I'm willing to forego that third one, but I did put it in if there's penalties for not for the unlawful disclosure. Although I do think it's important to not unlawfully disclose, I could be persuaded because I understand that would probably have to go to public safety and. Okay. But those two in particular, and I'd like to hear from the author if he'd be willing to.
Yes, what I'd like to do, since this was going to be for vote only, I do understand now that Senator Romero has 2 amendments. I also understand that Senator Romero and Assemblyman Portantino have had the discussion, and so I would like to go to the author.
Before the response, can I interrupt?
Yes. Yes.
I'm sorry, Madam Chair. I just want to make it clear and known. I've committed to vote for this measure as is, and it might not affect it on the other side, but if these amendments are taken, I'm sorry, Assemblyman, I wouldn't be able to support it. I just want you to know ahead of time because I've committed to vote for it, but if these are, and you have to do what is best interest for the bill and what you think is the author, but I just want to let you know that.
Thank you.
And what I would like to say is that I supported the bill last week, and so I need to understand, Assemblyman Portantino, what it is that, where you are.
Thank you.
On these potential amendments.
Well, couple things.
Madam Chair, before we go to the author, Senator Romero mentioned Amendment 2. That would be very important to me. I think we're headed in a new area, and I think privacy concerns are paramount. At least they are to me, and so I'm very committed to that.
And
offer that.
I understand that. Senator Cedillo and Assemblyman Portantino, what you might do is, since I'm trying to hold the discussion to potential amendments here, is that on number 2, which Senator Romero said she did not need at this point, you might also mention how it's already covered under civil penalties, actually under some legislation that I had signed into law. So if you want to speak to all 3 and where you are on this.
Great. Well,
that's the whole point. That's the whole point, is that this amends that from the civil penalties to the...
I understand that, Senator Cedillo.
Well, first of all, I appreciate the committee's interest and support for the concept of umbilical cord blood and the thorough conversation we had the last hearing. As far as the contracting out issue, California companies, I think what has been referenced is another bill in another committee where we were taking public jobs and turning them into private jobs. This bill seeks to set this program up at the public university of the state of California, the University of California. We are setting it up in a public university. As far as contracting with a California-based company, we are also trying to prevent people from dying through poor quality cord blood samples. So this bill seeks to, again, put California at the forefront of cord blood stem cell research and collection by conforming to federal guidelines. There is no California company that currently conforms to those federal guidelines. So in effect, if we take that amendment, we say this program doesn't happen, and frankly, Californians will die. And we can't take that amendment.
Okay. So on the First Amendment, you cannot take...
Can I just ask, why would Californians die? Because we're saying that whoever we bid to must just simply engage in collective bargaining. I don't understand what saying I agree to have labor and management sit down and negotiate a contract means that Californians die.
There is no California-based company that meets the federal standard.
Right now.
Right, and this would require...
But this bill is being written in that if we do contract, that they must then say, bring your folks to the table and let's just negotiate.
But we're talking about federal approval for their standard as well as collective bargaining. There is, let me say that again, there is no California company under collective bargaining or not under collective bargaining that meets the FDA standard that we're putting in this bill. Period. It doesn't exist. And if we delay this program, people will die. It's that simple. So I can't take the First Amendment. On the disclosure, I think the chair understands it perfectly. The laws are in place. We don't need to put the felony penalties into this bill. I'm happy to commit to work with the chair of the Senate Public Safety Committee next year. If there's things that we need to do, I commit to work with Mr. Leno on seeing if there's regulation that needs to be put in place. I believe what the chair has done in prior legislation is sufficient. As far as the death certificate versus birth certificates, I think, again, Mr. Leno covered that issue quite succinctly and eloquently at last week's hearing, that we are not diverting any money from anybody with this bill, and it would be the first time that we know in public policy where we're going to presuppose and say some future revenue source is the domain of exclusively to someone else. Frankly, I'm open. I'm not going to commit to today to take the death certificates. I'm open to have further conversation on whether birth certificate versus death certificates. People have signed off. We have wonderful bipartisan support on this bill. We've worked with the chair's office. We've worked with the Senate Health Committee. And frankly, to put people at jeopardy when they don't need to be at jeopardy, frankly, because something happened in another committee on another unrelated bill, I find offensive.
Okay, so what I understand is that you've definitely said no to the first two. On item 3, you're saying no at this time, although you're willing to consider it in future discussions in a future committee?
I'm willing to consider it, but I'm not making a commitment.
Okay, so if you all would like to propose an amendment, we can do it any way you would like, and we would vote on each one. No, we can't do it that way, huh?
No, can't do it.
These are to be taken. I mean, if you want to... How do we do this? Find it up.
I requestfully ask for an aye vote, the bill as presented.
Excuse me.
You want to...
Is there we did start this discussion with saying this would be as is for vote only. So
And I
Senator
respectfully
Pavley,
ask for an aye vote.
Senator Pavley has graciously
Thank you.
moved the bill in that vein. So we will call for the vote, please.
Senator Alquist?
Aye.
Thank you.
Alquist, aye. Strickland? Aye. Strickland, aye. Onnested? No. Onnested, no. Cedillo? No. Cedillo, no. Leno?
Aye.
Leno, aye. Negrete McLeod? Aye. Negrete McLeod, aye. Pavley? Aye. Pavley, aye. Romero? No. Romero, no.
5-3.
Thank you.
The vote is 5-3. That bill is out.
Thank you.
Meeting adjourned. Thank you. Excuse me. That was we did that as a subcommittee. Let's go back. This, members, is item 1, AB 2551 by Assemblyman Hernandez. We did this as a subcommittee before we had a quorum. So let's call for the vote. Is there a motion? Yes. Senator Leno has moved the bill.
Senator Alquist?
Aye.
Alquist, aye. Strickland? No. Strickland, no. Onnested? No. Onnested, no. Cedillo? Aye. Cedillo, aye. Leno? Aye. Leno, aye. Negrete McLeod? Aye. Negrete McLeod, aye. Pavley? Aye. Pavley, aye. Romero? Aye. Romero, aye.
That vote is 6-2. The bill is out. Thank you, members. Meeting adjourned.